So, Simon Kennedy, can you name one lesson or idea from abroad that's helped you or your colleagues?
Well, I think one thing that has been really helpful to us over the last year or so has been to look at the experience of other jurisdictions when it comes to the issue of medical aid in dying. We had a Supreme Court decision here in Canada which provided that this was a right that people had in certain circumstances to have access to medical aid at the end of their lives. And obviously this is a subject that is very sensitive for a lot of people. So we were very grateful to be able to look at the experience in jurisdictions such as California in the U.S., but also the Netherlands, Switzerland, and so on. And it was very helpful to us to look at the kinds of protocols that other jurisdictions had put in place, the kinds of history they had once they had moved to put in place a system. How was it used? What kinds of people availed themselves of assistance at the end of their lives? So that would be one example. Another very quick one would be that we are very interested in looking at how to improve the effectiveness and efficiency of the Canadian healthcare system. We spend we're a relatively high spender compared to the OECD, but we get outcomes that perhaps are a little bit lower than we would like. And so to watch what the United Kingdom has done in terms of its healthcare system, to look at, for example, some of the reforms that have been underway for a number of years now in the United States, whether it's medical care homes or accountable care organizations, to look at how other jurisdictions have restructured their healthcare system has been very helpful for us in trying to figure out what are some of those things we could do to bring those models to Canada with the aim of improving care and cutting costs.
Thank you. And are there any projects or innovations from Canada that you think might be useful to your peers overseas?
Well, there's a couple. One of the things that we face a challenge with in Canada has been relatively high drug costs. In our country, we don't have a single purchaser. We don't have a single formulary covering the whole country. We have a system in which our provinces and territories all do the purchasing on their own. They all manage their own formularies. And then we have private insurers who are also providing coverage. So what we have is we have an organization that was set up by our provinces called the Pan-Canadian Pharmaceutical Alliance, which combines the purchasing power of the federal, provincial, and territorial governments to basically negotiate with drug companies for all publicly funded drug plans. And over the last number of years, we calculate we've saved about $700 million in spending by basically having all of the public drug plans come together and negotiate as one. And that may be relevant to some jurisdictions that have this more fragmented purchasing that we have in Canada. The other area is that we have had really significant success in reducing smoking rates. So the number of Canadians who smoke daily has been cut from about 33%, so about 1 in 3 in 1980, to about 15% in 2013. So basically cut in half. And Canada was, one of the first countries in the world to introduce graphic warnings on cigarette packages. We're the first country to ban flavors like chocolate and bubble gum in little cigars and cigarettes, the kinds of things that make them attractive to children. And under this government, the government was elected last year, we're going to be moving to put in place plain packaging, which a number of other countries have done, and we're going to be aiming to make our rules around plain packaging, some of the most modern in the world. So I think tobacco control is probably another area where historically we've shown leadership.
Thank you. How can we improve the ways in which senior public officials sort of work with and learn from their colleagues overseas?
Well, there are a lot of fora, whether it's plurilateral or multilateral, where Canada engages, and where my advice to senior officials in other jurisdictions would be that you should look to those organizations as good sources of advice. So, for example, we are a regular, I would like to think, a key player in the World Health Organization. We engage regularly with the Pan American Health Organization and with organizations such as the OECD. There's a lot of good work, studies, and analysis that come out of those institutions. We actively engage with the G7, with partners as well, bilaterally, such as with China. We have a regular dialogue with China, with Mexico, with Australia. my organization is also a major regulatory body, so we regulate drugs, medical devices, other therapeutic products, and so we participate in international regulatory organizations as well. So, for example, we participate in the International Council for Harmonization of Technical Requirements for Pharmaceuticals for Human Use, ICH, which tries to work towards regulatory harmonization worldwide to improve safety and efficiency of pharmaceuticals. So there are a lot of fora that in the health space where there is an opportunity to work with and learn from others. And we certainly make an effort to prioritize our engagement in those fora because we think there's a lot of value.
Right. Now, that's a huge question. We only got a couple of minutes, but what are the biggest global challenges in your field over the next couple of years?
Well, there's a number that we think are really important. I mean, one of them is the issue of antimicrobial resistance. So if you look at drug-resistant, multi-drug-resistant TB, for example, the WHO estimates about 480,000 people develop multi-drug-resistant TB each year. This is a really serious emerging problem, and certainly something that in Canada we take very seriously. We have developed an action plan on antimicrobial resistance. We are trying to take a One Health approach, so looking not just at human health, but obviously animal health issues, because agriculture is a big part of this. Another area that we think is really important and that has an international dimension, and certainly in North America is something that I think our colleagues in the U.S. are also concerned about, is the issue of problematic opioid use. We have seen in Canada a significant increase in opioid use over the last 20 years or so, and increasingly, there is evidence that that people who perhaps were initially prescribed opioids for pain or for an injury, that when they're done using opioids in a legal sense, that because they've developed an addiction, they then turn to the street. And we have seen a significant upswing in deaths, for example, from opioids in Canada. There are some parts of the country where this now outpaces deaths from car accidents for young people. So this is a very serious problem. And the United States also has a very serious issue around opioids. And so this is an area where we think there may be opportunities to work with colleagues in other jurisdictions outside of Canada to try to tackle it.
Right, yeah. And the finally question is, what is your favourite book?
Well, I tend to read a lot of briefing notes and a lot of newspapers in my job, so I probably tend more towards fiction. I'm reading right now Being Mortal by Atul Gawande. So this is a book about how the healthcare system works and how perhaps it doesn't serve people very well at the end of their life. I'm finding that fascinating. In terms of fiction books, I guess probably I really enjoyed Cold Mountain, which is about a Civil War soldier who returns to his home in I think it's in the Blue Ridge Mountains. He becomes disillusioned with the war. It's very much like it's almost like a modern Thomas Hardy novel. Well, actually, it's not modern. It's set in the Civil War, but it was written recently, so it's like kind of a 21st century version of Thomas Hardy. I found that very affecting. It's not that new. It's probably 10 or 15 years old. But in my job, I read the national papers, the New York Times, and a lot of technical reports. So I think that's probably my. If you go by how much time I spend reading, that's probably my favorite stuff to read is the stuff in the office.
Right. Thank you very much indeed for that.